So there is a change in the sequence of lectures for this morning. Our next lecture is Professor Zhanglian. I hope I'm pronouncing their names correctly. He's currently the director of Chongqing Haifu Hospital and a Secretary General of ISMIDS and the Chief Editorial Board member of the International Journal of Hyperthermia. So Professor Zhanglian is one of the chief researchers working to develop the HIFU. So we have the HIFU because of him. And he has driven several studies and researches regarding the application of HIFU technology in the treatment of uterine fibroids and adenomyosis. So to welcome Professor, he will be lecturing the clinical application of focused ultrasound ablation, the state of the art.
后面就是你的那个 PPT。
Yeah, thank you. Good morning, everyone. It's my great honor to be here. Actually, have this chance to give this presentation. It's my first time here. So actually, I asked Silva. I thought maybe he came here many times, but he told me the second time for him. So it's great. So we have this chance to meet many new friends here. So my presentation is about the HIFU. Actually, I can share with you about my experience here. About this technique, I think everybody already knew about it. It is a non-invasive treatment. This slide shows how it works. Here is the transducer. The ultrasound beams were generated from this transducer and just focus at a very tiny point some distance away from the surface of this transducer. During the treatment, the ultrasound beams penetrate the human body and just focus at the target in the body. When the temperature increased to over 65 degrees, the tumor, necrosis occur in the tumor. So for a monitoring image, ultrasound, real-time ultrasound image, we can see the graceful changes. Like here is the liver, the pancreatic cancer here, we can see hypoechoic here. So during treatment, we see the graceful changes like this. It means the temperature increased. Then here, just like the vapor. So here I just show you how did we do this. For example, here the liver cancer, then we start to treat. We see the graceful changes like this. Then we move the transducer and focus on another point. Then repeat again. When we see the graceful change, the area cover the whole tumor, then we can terminate the treatment. So here is the procedure. So it's different from surgery. When we perform the surgery, we are going to remove the tumor out. We can see clearly, but for this technique is non-invasive. We have to use an image to evaluate the treatment result. For example, the MRI here, multiple uterine fibroids. Before treatment, we can see the contrast enhancement in the fibroids. After the treatment, no perfusion in the fibroids. It means all the fibroids, like already necrosis occurred in this fibroids. So the follow-up image here, 4 months after that, we can see this one and this one disappear, and here disappear. Only this part, this fibroids, is still a small portion, still here, probably 2 months later will disappear. So we are going to use this image to follow up the changes of the treated fibroids. So it means after treatment, the treated fibroids were going to get smaller, smaller, and smaller, then disappeared. Of course, the most important about the symptoms. Actually, this technique was first proposed by the scientists from the US in 1950s. And in Chicago, Fry brother did the experiment and showed this technique may be used non-invasively to treat the tumor in the future. However, this technique didn't develop for a long time because at that time there was no monitoring image until 1980s with the development of the diagnostic image. This technique received international attention again. So Professor Wang from Chongqing, our group, he started this project in 1988. This is transducer he designed. At that time, we can see this black box, and we can see here the water in there. We can see the ultrasound beams come from the transducer and focus at this point. We call this AFR, acoustic focal region. The corresponding necrosis area in the tissue, and this BFR, biological focal region. It can be smaller and also it can be larger. It depends on how do we want to use it. So after 10 years basic research in 1997, this technique was first used in clinic to treat the patients. The first case we treated is osteosarcoma. So now there are two types high-intensity focused ultrasound treatment system. Is one ultrasound guided from Chongqing, and another type is MR guided from GE and also from Philips. So now the MR guided one both focus on the brain diseases right now, and for the ultrasound guided one, we are used for different types of solid tumors and also some benign diseases. So now I'm going to show you the HIFU treatment for liver tumors. We also have so many ways. What kind of role HIFU can play? So for this technique, we can use it to treat the tumor in the difficult locations. For example, like this one, this lesion, like this liver metastasis from colon cancer, just this very small lesion, just adjacent to the IVC. So no other choice. We can use HIFU, just focus this point, this area, then we start to solidicate. You can see the grayscale changes like that. So only 30 minutes, we completely ablate the lesion. So the PET scan shows the lesion was completely ablated. The CT scan showed the lesion was getting smaller in 1 month. So another case like this, also close to the IVC, here the HCC. So this patient, you can say, just had RFA before, only actually part portion of the lesion was ablated. So for the residual tumor, because it's still small, can be achieve the curative treatment. So we decided to treat with the HIFU. So here is before. And during treatment, contrast ultrasound shows the lesion was completely ablated. This 1 day after treatment, CT scan shows the lesion was completely ablated, no residual tumor around this area. So 1 month and 3 months, you can see the change is getting smaller and smaller. So this one also, like treatment 1, liver metastasis from colon cancer, no other choice. Then we treat it with HIFU. So 33 minutes. Here is 1 day after that. The CT scan shows the treated region was much larger than the tumor. So for the curative treatment purpose, we do just like this. Here, 30 days, 1 month after that was getting smaller. You can see the margin was very clear and no damage to the surrounding structure, no damage to the blood vessels. Here, 3 months, 8 months, here's 2 years, 3 years disappeared. So for these difficult locations, HIFU is a choice. And another one, I just want to show you with the HIFU treatment for pancreatic cancer. Actually, we all knew that the prognosis was very poor. It's very poor for the patient with pancreatic cancer. Usually, no other choice. Even at the early stage, when they undergo the surgery, average survival time just 19 months. So most of them actually no other choice. If we use a chemo, no response, like the median survival time is around 3 to 5 months. So how can we do? So this patient, actually we did from different centers. You can see at the beginning, actually for the pain relief, higher than 80% of the patient can achieve the pain relief. And right now, actually, we can over 90% have the pain relieved. And the median survival time was getting longer and longer just for the stage 3 and stage 4 advanced stage of the pancreatic cancer. So for example, like here, the Bonn University, Germany, actually, they started this project in 2014. I was there and I worked with them for 2 months. So they published the results actually 2016. At that time, 133 cases, and most of them stage 3 and stage 4, you can see here, and have 5 cases had the surgery, but the patient had recurrence, and 41 patients, because of the jaundice, they performed the statin first, then had the HIFU treatment. So the treatment time is around 2 hours, and the folication time is not so long. And after the treatment, we can say that all these patients have the pain relief, even stage 4, both stage 3 and stage 4, have the symptom relieved. And for the local control also, both stage 3 and stage 4 achieved the significant changes. For the survival time, like 16.2 months from the diagnosis. So the patient for sure is benefit from this treatment. This is the first case I treated together with them. You can see this patient was 56 years old. First had a surgery, but when they opened the abdomen, but the surgeon said that we cannot resect it, but get the biopsy and refer to the department radiology for the HIFU treatment. This MRI, before treatment, we can see the lesion over there, 4.8 centimeters. So because the first case, well, safety is the most concern is about safety. So we just solicited for 700 seconds for the solicitation time. 1 day after that, the MRI shows this is treated region. Low enhancement in the treated region, but the surrounding structures, low damage. Here, we can see there's a follow-up image. Then you can see the lesion was getting smaller, and this 6 weeks after that, here, 3 months after that, only 8 millimeters was getting smaller. They were so excited about this case. And here's 1 year after that, disappeared. Also the tumor marker, you can see the changes, return to normal level. So they are very excited about this. So that's why they use this for the patients with pancreas-related. They treat a lot of cases right now. So, and another reason for HIFU for pancreatic cancer, just because this non-invasive. For example, let's say a patient first treated with HIFU, but 15 months had a recurrence, but we can treat it with again because low damage. So like this case, here the second HIFU treatment, then this time after treatment, you can see 6 months after second session of HIFU treatment, the shrinkage rate was 80%. So for the bone tumors, for the primary malignancy of the bone tumors, we treat this one, we already published the results. For the 5-year survival time, is just comparable with the surgery. Like this case, this is 18 years old, we can say osteosarcoma. This before HIFU treatment, we gave the chemotherapy. The response was good. Then we treated with HIFU just 1 session. We completely ablated the lesion. Here, 1 year, 2 years, and 3 years, tumor-free. The patient still alive and tumor-free. And for the bone metastasis, HIFU is very good for the pain control. It's better than radiotherapy, and also it's better combined with radiotherapy. The patient can achieve the quick pain relief. So for example, like this case, this patient had a colon cancer, then later had a liver metastasis, and then had a radiofrequency ablation, but unfortunately had a little CD. There, the patient had a pain score 7 to 8 before HIFU treatment. He couldn't sleep on sofa, so on bed. I mean, only can sleep and sit the whole night. So the patient treated with HIFU, 2 hours later, the patient show us they can sleep on bed, so no pain anymore. So that's good for the bone metastasis and for the pain control. Also, this case actually this patient you can see multiple myeloma. Then the lesion was 10 centimeters, low response to chemo, radiotherapy, no response to any other treatment than treated with HIFU. So you can say before 1 month, 4 months getting smaller than pain relief. And also for the benign tumors is a big indication. And later, Dr. Silva and also and some other doctors will show you about their results. So briefly, I just briefly give a sample introduce. So we start using technique to treat the patient 2000 for the uterine fibroids, but between 2000 and 2005, that's just for clinical study. We didn't treat so many patients, but that's important for the optimize protocol and also the machine. So from 2006, we use this system routinely in China to treat the patients. 2007, we use this technique to treat adenomyosis, but now for the other indications in China, the gynecologist, they use this to solve the chronic problem. So for the uterine fibrosis, this is real world data from 2006 to 2009 in our hospital. And you can see the baseline characteristics. And we treated submucosal fibroids intramural and also subserosal fibroids. So the lung perfused volume was over 80%. We didn't ask for the 100% non-perfused volume ratio. Why? Because because it's the benign diseases, we don't want to have the patient get a serious complications. So safety is very important. So for over 80% average non-perfused volume ratio, if it's enough. So we can say from here, the follow-up results shows the symptoms significant improved and sustained for 3 years. So it's good enough. And also you can see the shrinkage rate. Here about 3 months and here about 3 years. You can see the shrinkage rate at 3 years, almost 90%. So that's average. Some patients, shrinkage rate getting smaller quicker. Some patients get slower. So this is about an average. Also, let's start from the US, from Mayo Clinic. You can see their study also shows if the lung perfused volume achieved like over 70%, this here is about a 2 years, like the reintervention rate, just around 10%, is comparable with the surgery, with the myomectomy. This is their result. So here we can see some cases like here's before, here's 1 day after that was completely ablated. Here's 4 months shrinkage rate about 30%. Here is 10 months after that, 73%. So also for the multiple uterine fibroids, like if they want to have the baby, then HIFU is a good choice. For example, like this case, you can say if we perform myomectomy properly, we can resect, we can remove most of the fibroids, but maybe still some smaller still there. So maybe 1 year, 2 years get a recurrence, but we treat with HIFU. We can say selectively updated even smaller, we can treat like this. So low damage to the myometrium between the fibroids. So for the patients, when they want to have a baby, like this case, 1 month after that, they get pregnant and deliver the baby as terms. So also, if the patient wants to have the IVF, so we also can use this technique precisely ablate the lesion without damage to the endometrium. So it's good for the IVF and short the the waiting time. So for the adenomyosis, also Silva will show you about this, and also you already knew about this disease, so it's still a challenge for us. But we can use HIFU to help this patient. We start to use this technique to treat the patient with adenomyosis in 2007. So we can selectively ablate the lesion without damage to the surrounding structures. Here is about a study from from 3 centers in China. We can see the baseline characteristics of the patient, and you say the treatment time is like 1 hour and 40 minutes. But for them, the clinical effective rate is around 80%. And also for the dysmenorrhea is the same way. So the different types of adenomyosis, we have the different like the treatment strategy. And also Silva will show you with this about this. And for the patient, if they want to have the baby, then we have to protect the endometrium and also serosa. But for those they don't want to have the baby, we can treat more aggressively, just like this. Instead for the long-term results, for example, like this case, you can see the changes. Also, for they want to have the baby, then for sure, after having treatment, the patient benefit from this one, they have more chance to get pregnant. And also we use this technique for the other indications. For example, maybe you don't have this one, but we have the cesarean pregnancy in China. We treat something like this, should be okay. And for the placenta accreta, you also knew about this. Then it's easy for us to treat. After they treat for the patient, some of them, like the placenta were expelled by the uterus. So for the others, abdominal wall endometriosis is also a good choice. And for also the new indication, maybe in the future, we can try to use this technique to help this patient. And also this technique right now, we can use this for the resistant hypertension. We are doing this right now, but right now about indication more than 166 indications can be used for this technique. And from the FAST Foundation, they concluded this is like the revolution, the game-changing technology. So we are using this technique right now for the fusion image, MRI, and ultrasound for the monitoring. And also in Chongqing, we have the HIFU Telemedicine Center. And in the future, actually, we can work together through this center, and we can discuss a case, and we can treat together with the patient. So right now, the technique already mature, and all like in all the wide world, 32 countries. Countries and regions are using this technique. So this our city. I hope actually you can come to visit us next year, because next summer probably we are going to have the 5th Young Summit. And this last year we had this meeting, and also Philip was elected as the president of this society last year in Chongqing. So next year we are going to have this meeting. I hope to see you in Chongqing. Thank you very much.